Welcome for joining us today for business continuity planning, protecting tomorrow's care by planning today. My name is Penny Bartelt. I'm a behavioral health project specialist with the BH Connect project. Because this is a lunch and learn, you can feel free to ask questions while I'm going along. Probably the best way is to do it in the chat and I'll come to it at the end. But if it's something that's really relevant for the slide I'm on, please feel free to raise your hand. Courtney, I can't see my team screen, so feel free to just interrupt me mid-sentence or whatever and ask it, okay? So in preparation for today's event, I did a lot of looking at a lot of different things. I even did a basics of disaster recovery certification. So really trying to break this down in hopefully a way that's easy to understand and help you get started on your own business continuity plan. So our objectives today are to understand the purpose, importance of business continuity planning and behavioral health, learn how to develop a BCP through a step-by-step overview of the planning process, and then explore practical tools and resources to support your BCP efforts. And I think it's always really important to note we are recording this presentation and these slides will be available, which is really important because there are some really great resources in the slides.
I don't think we used.
All right. So also, if you did register for this presentation, we will email you the slides, the recording, and also our sample template that we're going to show you guys today. So what is business continuity planning? So business continuity is the ability of an organization to continue to function before, during, and after disaster. And I think that before is a really important part that makes this planning so important so that you can try to prevent what you can and function as well as possible when something does happen. And then an actual business continuity plan, or BCP, is a proactive strategy that prepares an organization to maintain essential operations during and after a crisis. So it really outlines those procedures to sustain your business operations while you're recovering from that disruption. It really gets you thinking about the what ifs. So if this happens, what would we do? And try to make it a little less stressful when those things happen. It's still going to be stressful though. So why develop a BCP? So this is the list, and I think that I saw a couple of places they did a really good job talking about the 4 Ps. So people, processes, premises, and providers. So if you really think about it, you're trying to concentrate your efforts to safely maintain operations during a disruption and minimize impact on those 4 areas. So you're trying to protect that life and safety, preserve your assets, so this is a different way to look at it. But again, it's really those people, processes, premises, and providers. You can read that on the screen. I'm not going to read to you. So BCP. So another really important reason is if you've done a security risk assessment with Behavioral Health Connect, this will look a little familiar as far as we have a whole section on emergency and contingency planning, but it is actually required in the HIPAA security rule. And if you haven't done an SRA with us, I'll give a little plug that we're great to work with, and it's a great thing to talk to us more about. But even if you don't do your SRA with us, really looking at that contingency plan as a requirement of the HIPAA security rule. So it talks about you need to establish and implement as needed policies and procedures for responding to an emergency or other occurrence. For example, fire, vandalism, system failure, natural disaster that damages systems that contain electronic protected health information. So again, the security rules got that EPHI focus, but really for your businesses, purposes of your business, you're probably looking broader than just your EPHI. You're looking at how do you continue to operate. So underneath that main statute, there's these implementation specifications about a data backup plan, disaster recovery plan, or sometimes called a DR plan, emergency mode operation plan, and that's really focused on how do you continue critical business processes and secure that EPHI. Testing our visions, applications, and data criticality analysis. Those are all things that we ask about in the SRA as well. So The disaster recovery plan and emergency mode operation plan, they don't have to be separate. A lot of times you're going to wrap that right into your business continuity plan and not really spell out this is my disaster recovery plan. Large organizations like counties or tribes, they usually have like an emergency management type plan, a very large plan. And so they might have a separate disaster recovery plan that really is their IT's main focus, because a disaster recovery plan is defined as procedures to restore any loss of data. So that's what a disaster recovery plan. It's not intuitive. I would not think that that's what that means, but it's really that IT focus. So today we're going to focus on the smaller, like if you're a county, more like a department level, like what would you do in your outpatient clinic if something happened, rather than the really large plan. But things that we talk about can be applied on a larger scale as well. It's not different terminology or anything. It's just the our template is kind of everything's geared more a little bit for a smaller organization. So BCP overview. So we're going to, this part is really focusing on, we developed a sample template. We looked at a lot of different resources and we came up with, this is really the core stuff that you need to know. And here's a template format for doing that. Doesn't mean you have to use it. There's no requirement to use it. It's just, again, a courtesy document that we created for you if you want to use it. So to start your business continuity planning, very first step is determine your business continuity planning lead. Who's going to take ownership and really drive this forward in your organization? I think we all know if you don't have an identified person, it can fall through the cracks very easily. Now, if you're a small organization, you might just have that one person really working with everyone else to pull it together. Otherwise, if you're fortunate enough, bring some friends along to the party to really work on the planning and establish an actual team. So once you have that established, you're going to develop your actual business continuity plan. We have our sample plan that we have available to you, and then there's additional tools, templates, examples, all linked in that references and resources in this slideshow. So where we start with our sample template is the executive summary. This is really your policy statement for the document and defines why business continuity planning is important to your organization. As with everything I'm showing you, all of this needs to be made specific for your organization. Change it, add to it, delete things, whatever you want to do to make it your own. We include this optional section at the very bottom in italic that it's something just to think about if you'd want to include something about your board of directors being in support, depending on what role they have in it, to show that, again, that support, that this is important to this organization. If you don't have a board of directors, you can delete that, or you just don't want to include it. Everything is really optional. The next is the first kind of big step to do is a threat and hazard analysis. So this is similar to our threat source list that we provide, and you could use that. It's just got a little couple extra fields on it to be more specific to business continuity planning. But you're really looking at what potential disasters or risks are there, and then what's the probability of it happening, and then the possible impact when it did happen. And you kind of combine those, and it gives you a mitigation rating. And that mitigation rating is a lot like on the SRA, where we have you rate the risk to help you prioritize. So something with a higher score is a place that you're going to maybe want to put a little bit more attention to than something a lot lower. So when you're looking at these ratings, consider the history. If you live somewhere and you're like, you know what, we've never had an earthquake, looked online, looked at some records, there's never been an earthquake in this area of the state, we're not on any fault lines, that's probably a pretty low probability impact, things like that. Flood, on the other hand, if you are lucky enough to be lakeside or riverside and it floods every 10 years and you're on year 8, okay, that might have a little bit higher probability. Also, you can add potential disasters to this list. So like if you work in a really old building and you know, like we have just, or the internet just has more issues going out, you might want to list that as an additional type of disaster just based on something that you really want to hone in and take into consideration. But the idea of this exercise is to really look at what is the potential consequences of this event and how can you mitigate it. So you're looking for vulnerabilities, weak areas, and then implementing prevention controls and mitigation strategies. So again, if it does happen, maybe it's getting a generator that can limit if a power outage happens as a result of like a snowstorm or something like that. In the toolkit and in the slideshow, we have some linked toolkits from ready.gov that provide really detailed scenarios to help you understand what could be some potential impacts. You know, what is the ripple effect that you might not be thinking of? So those are really great to help with just thinking about where to even start. There is also this optional cybersecurity impact analysis that we have linked. It's Appendix F. This is a checklist of a lot of things that are more that cybersecurity side of things. If you've done an SRA, I think all of those items are included in the SRA. So it would be duplication to do both. So if you're active in your SRA process, that security risk assessment process, I wouldn't say you have to do that extra checklist. But if you're like, I have no idea what an SRA is or why you would do it, I would recommend doing that as part of this process and also talking to us about how you can complete a SRA. There's also this detailed analysis option. It's a hazard vulnerability analysis. It's a lot bigger tool. It has a lot more columns. It has colors. It's a lot more complex. It's used a lot of times in like nursing home settings, things like that. Provided a link for that for your reference as well if you're looking for something that's maybe a little bit more robust. So business process analysis is the next step. So, and you can do these in either order. It doesn't mean you have to start with that and then do this, but this is the order that I thought made the most sense. So you start by asking, what are your business processes? So then you look at, when you list them all out, what are your essential critical functions and rank the order of importance? And this again helps you prioritize as far as what do we need to be doing if there is something that happens. So when you're looking at this list, you want to think about, is it required by law or regulation? There are some things, especially in behavioral health, that you are required to probably be providing and things like that, based on contracts or requirements for your programs. Is it required to maintain the safety of clients and staff? Does it provide a vital service to clients? And then as a final consideration, if you have business associates, what impact would it have on them? So what are your mitigation and recovery plans needed around those relationships? And we're not focusing a lot on business associates today, just because that really kind of muddies the water. We're trying to kind of just focus on the simple side of things. So here's an example of essential and non-essential functions. And I include this mainly to get you, if you're like, oh, I'm not even sure what you're thinking of as far as what would possibly be some functions. They have a really good list in the SAMHSA TAP 34 disaster planning handbook on page 58. And it's actually page 77. Like if you do the PDF and you want to type the page to go to, it's page 77 to go to. But it can get you thinking about what might be essential versus non-essential. This is the example of the document that we include in our template. It is a simple word table, and you list your functions in different categories, and then you just list is it essential or not. And these are just some of the examples we have. You can take them all out, you can erase them, you can leave them, you can add to them. Again, this is really your document to make your own. And this is a good example of if you do have a lead where they probably are going to need to work with other departments to really know what are their essential processes and functions and what do they all do, just because unless you do the job, it's hard to know all the subtle things that they might be doing and what they're responsible for. And you might not think something's critical, but it has that ripple effect on other areas, which will be in another section we're going to talk about, which is the business impact analysis. So after you do your business process analysis, or BPA, you do a BIA, because we love acronyms and it's fun to be able to throw lots of new ones out at you. So the purpose of a BIA is to identify those critical functions and assess the impact of their disruption. So once you have your list of these are all essential, you're going to do this next step to really look at how do we support them in times of an emergency or situation. So you do have a couple options on how you document this. You can include the document templates that we include in our template right in your BCP, Or you can just include a summary and store those worksheets separately that's referenced in the BCP. It's really up to you how you want to store it, but just wanted to note that you don't necessarily have to include them in there. We do for our purposes. And then FEMA has a whole PDF document on process analysis and business impact analysis. So that is something that if you're looking for a little bit more detail or anything, it's another resource. So this is what the BIA looks like. So really for each thing, you're going to look at each thing, the function or process. You're going to write a description, who might be the lead or the staff, the communications and IT systems that are involved in that process, alternate location requirements. Is this something that could be done from a home? You know, if the office is closed, could you do that at home, or nope, it needs to actually physically be somewhere? And then, like I talked about, that ripple effect are those dependencies and interdependencies. So how does this fit in with other processes? So you understand those connections. And then really kind of has you look at what is the plan for short term, you know, less than 3 days. And then in the world of business, 3 days can be a long time. But if you look at longer than 3 days, sometimes you can come up with, this is what we could do for a couple of days. But man, if it's longer than that, we've got to come up with a longer plan. Okay. So it really helps focus prevention and mitigation efforts as well when you look at what would happen in those situations. So now we move to what happens if there is an incident. So we talk about plan activation. So in the sample template, that's the next section, is how is it activated? Again, you're going to change this verbiage to what works for your organization. So you're going to ensure safety of personnel, notify your emergency response team. You may not have it. It might be you're notifying, you know, your clinic administrator, or not your clinic administrator, your support staff or something like that. And then we have some linked documents as well that I'm going to go through. So you assess the situation, you activate the BCP, and then you communicate with stakeholders with the emergency contact or communications plan, and then we have important contact information. Just going to note this essential equipment list is another resource that you could, if you're renting, it might be something you just delete. Like, we are not responsible for our heating and cooling system or any of those things. But if you are, or you have essential equipment, it's a place to write down serial numbers, make models, things like that, that you might need if something were to break down and you really, you know, you have to call someone, you've got all that information about that piece of equipment right there. So your emergency response team contact list, this is where you're going to list, you know, what the roles are, name, really important, secondary phone numbers, how do you get a hold of them if really needed, and then a backup. You know, if that first person not available, who's the backup to them, or if they have a role, who's backing them up. For emergency communications plan, this is actually a policy and procedure type document that we've included for you guys to make your own, but it really breaks it down into staff communications. How are you going to communicate them to notify them that there's an emergency? And then if there's a failure in this primary communication, how are you going to let them know? And I think a great example of this is when cell phones were down. You couldn't notify your staff via their cell phone. You know, if for some reason cell phones aren't working, what would be your option? Just like if email's not working, something like that. And then this is really important. An updated list of primary emergency contact information for staff can be found. Where are you storing that information? I know at my employer, we're asked to update it anytime there's a change, but we also have to review it once a year. So it might be developing a process around how do you make sure people are reviewing that upon hire, and then how often are you making sure you've got accurate phone numbers and how to get a hold of people if you need to. And then client communications. How are you going to communicate with your clients? Consider, how do you get that client list if your electronic health record is down, or if you can't get into your calendar to see who's coming in for the day. So what are your backup systems to know who people are and what their needs are? There's external communications. Again, how are you contacting if you have others like vendors and things you need to notify? There's a spot for public information, who's talking to them, and then making sure you test your communication system. So if it is, you're going to send out a text to all of your staff. It might be you have a group text already set up in a phone that you test every once in a while, and you just send a test text, something like that. So again, it's always good to check those methods to make sure they're going to work when you need them. Then we have a part for listing those important contact information, because in the time of an emergency, the last thing you want to be doing is looking for phone numbers and information. So we have your EHR vendor information. If you don't have internet and you can't get on a site to look up how do I call them when I normally email them, having that information available. If you have external IT support, how do you get a hold of them? This one is insurance carrier broker. So if you did need to make a claim or something like that, you know your policy numbers and all of that are readily available. Also an agency and vendor. So emergency numbers. If you are renting, landlord or property management contacts, utilities, just having those numbers readily available. So something to consider for insurance is something called loss of income coverage. If you have what's called a business owner policy or a BOP, it's usually included that, or if you just have a general liability commercial policy, it's an add-on to that. But you might want to review that as far as what your coverage is and the amount available. It's just as part of your planning to know, like, hey, does that seem like that is accurate amount, or, you know, is your coverage what you need? Something that you may not think of is your reputation and the impact that can have on a loss of income, as far as if you're not getting new clients or losing clients. That is something that loss of income coverage can help support, as far as if you need to increase marketing, or they a lot of times have support for businesses that maybe need to rebuild their reputation. An important note is cyber type events are typically excluded. And when you think about it, it makes sense, because the insurance provider wants to sell you a cyber insurance policy that's very specific. It has a lot of requirements for any business that wants it. So that's why those are typically excluded. There is a nice handout that we have linked here. It has just a nice little overview about business interruption insurance, that we are vendor neutral. I'm just going to say that we're not pushing any types of insurance. This is something that's referenced in either ready.gov or FEMA. It was a resource they had in there, and I thought it'd be very helpful for you guys. So that's why it's from, I think, the Hartford, but I looked and I couldn't find or actually I might have that be an article now that I think about it. So I think I covered that to make sure it's not supporting any specific insurance carrier. Recovery phase. So you've activated your business plan. Now recovery phase is, how do you recover getting back to normal business operations? So you activate your plan, and then there's recovery plans. We include some sample recovery plans in our BCP sample template. So we have an EHR downtime, emergency office closure, power outage, and shelter in place plans. Again, these are really meant for you guys to make them your own. The BCP template that we created is an all hazard approach. So rather than having a tornado recovery plan or a snowstorm recovery plan, we're looking more at kind of the root of what the issue is going to be. And if it's our office had to close, this is the standard process, regardless of the reason. So just wanted to mention that all hazard approach, because you'll see that language in the template, but that's what it's addressing. So something to consider with electronic forms is that you have forms that you need for continuity of operations and emergency response. So it's really, oops, got a typo on there, sorry. So it's really important to store copies in a cloud or USB locations. If you think about, if you can't get on your computers for some reason in your office, at home, whatever, having these alternative locations can be handy. And really, you need paper copies, because if things are really bad, you need those paper copies that will help you continue to operate. So having the paper copies, knowing where they're kept, you might want to create a facility go kit that has those and other important documents and resources available in it. So part of your recovery phase is determining that criticality of systems and functions based on priorities. So priority one, order one, typically is going to be your EHR. 2 might be like your email. 3, billing. Really thinking about, you know, if everything's down, what do we need to focus our efforts on getting up first? A lot of times you never know if everything's going to be down, but if it is, where are you focusing efforts? And if you are cloud-based, I believe we have a note in there too that says, you know, if you're cloud-based, you're going to work with the vendor to restore the system. You know, there's not much probably for you to do other than really partner with them on what they need. Then you're looking at facility access. So how are you facilitating that access? Are you able to work from home, or do you have another office location, or even they talk about MOU as far as, we've worked out with this other clinic in town. They've got an extra space. We could go see clients there if we needed to. So really identifying the site location and what that alternate location would be. And then the goal of the recovery phase is to resume normal operations and deactivate the BCP. So to deactivate, this is just some standard language. You're going to do that when everything's contained, everything's good, and who's going to do it or how. Basically, you're getting at how do we know it's business as usual. Another important part of your BCP is training and testing. Doesn't do you any good to have this wonderful plan written and nobody knows about it and nobody's ever heard of it. So making sure you train people who are part of those emergency responses and also staff so that they know what is in it, where do they find things, all of those types of needs. And then minimally test parts of your plan every year. So it might be sending out a test message to see if it works and testing what would you do if the power was out? What we have written, does it actually work? There are some resources that are really helpful as far as doing different ways to test. Tabletop exercises are where you kind of have where you simulate an event and see how everything works. Those are a really good idea to do as well. Make sure that you review your plan and update it after every test and every real incident. Did you have what you needed in that time? Important to maintain your plan and then also distribute. So making sure people have copies, you've got printed copies, storing a copy on a cloud location or a USB flash drive, making sure you know where you have it so that when you do update it, you make sure you're updating everywhere you need to update. This slide I include just so you can see that there is a NIST format for business continuity planning, and it might use a little bit different order, different words, but it's along the same lines as what we went over here today. So if you're someone who likes those federal documents, we have that reference and just thought I'd give you a little snippet of what that looks like. So references, a whole lot of references out there. Please use these. They have templates, examples. It can be overwhelming. So just to warn you, we tried to narrow it all down into a template. But again, if you're stuck or you want to see examples, there is a lot of them out there. I did include two at the very bottom of this one. There's 2 videos. So if you're maybe kicking this off with a team or others and if we had more time, I would have showed these to you guys. But those are something you can watch on your own as far as just kind of a different way to set the stage for why to do business continuity planning or just a little bit different format for some information. And then finally, to discuss your organization's support needs around business continuity planning. If you already are working with a project specialist, just reach out to them. Otherwise, you can contact us at bhconnect@metastar.com. I will say if you haven't done an SRA and are interested, these are the same people to contact for that. That's a really good place to start because it looks at more than just business continuity planning as far as risks and vulnerabilities. So would really encourage you. If you don't know about that, let us know. We're happy to provide some education and support around that. Thank you guys all very much for joining us. Hopefully this was helpful, and I'm sure we'll be in contact with some of you at some point. So have a great rest of your day. Thank you. Bye.